Good afternoon, everyone. It's really good to see so many people here. And we're really keen for people to use technology today. So we want you to tweet about the event. And that's hashtag CASA Kent. Hashtag CASA Kent. All the relevant information about the event is in your delegate packs. And we are very pleased to have our colleagues here, people from industry. So the marketplace will be open again after the event this afternoon. So I'd really like you to have an opportunity to talk to some of the exhibitors who've got some very interesting products that they want to talk to you about. So it's really good to see such a good turnout, and I hope you have an innovative, exciting day with CASA. We're very lucky to have some really good speakers who are going to tell us about their experiences. And also pleased to have Fabian Dominguez, our CASA lead for the regions here today. So, what I'd like to say is that really we need to have a bit of revolution about here, because unfortunately if we don't do some real things to change in the NHS and social care, then I'm not sure that the NHS and social care is going to be sustainable going forward. So we've got some very good people in the room today, so today is our opportunity to really hear what's going on outside of Kent and how this compares with Kent and what we're doing here, because there's a lot of good things going on in Kent, but a lot of it isn't systematized enough to actually make a huge difference. So we've got a lot of experience with telehealth and telecare, and we're going to hear about some of that later on. But what we've really got to try and do in Kent is try and implement some of these ideas at pace and scale. We've had a lot of pilots. The talk is now we can't just keep having more and more pilots. We've got to now radically change the way that healthcare is provided. You may know that Kent has been made a national integration pioneer, and I'm very pleased to chair that group. And really the reason why we wanted to have that is because we feel that integration is one of the ways forward. But integration isn't just about putting a whole load of people together who perhaps before weren't together. At least it's better that they're now together and they would be talking together. But actually we've also got to do something differently. It's my belief that at the moment we're a bit lucky, because we know that we're on the Titanic and we're heading towards the iceberg. Well, we're lucky, we know that. But unless we do something radically different, all we'll do is we'll still hit that iceberg. There is also a problem, as we all know, that a lot of the problems in the NHS and social care is around things like leaky buckets. So there's money coming out of the system, and if we're not careful, all we'll do is just make that leak happen more. So I'd really like you to join with us today to try and see how we could move this and try and do something radically different. So this Kent Integration Pioneer Group is actually a working group of the Kent Health and Wellbeing Board. And as I said, we now want to use your innovation today, your skills today, to see how innovatively we could make Kent a better place and make sure that the NHS and social care is really sustainable. I'd also like to move on to say that we have a real opportunity about using technology in new ways. There's been a technology revolution out there. The citizen is much more in control of information that they never had before. So we really need to harness this revolution and really try and think about ways that we could use technology in a new way that actually put the citizen at the center. And then how do we use the technology to connect and coordinate people providing those cares, including the person themselves, because the person now is able to do a lot of the monitoring of these systems themselves. There's a lot of technology out there that's actually very cheap and very easy to coordinate, but we've got to have a change in the way the health system works to value that monitoring. So I think it's a bit like Doctor Who. I don't know if, I'm not sure of we've got several foreign guests here today, but Doctor Who has gone through a bit of a revival because of the fan club of Doctor Who and its 50 years. But I think it's a bit like that. We've got a TARDIS, but unfortunately the TARDIS is a bit small and it's getting a bit old. And what it really needs is to use technology and new ways of working so that it's a true TARDIS, so when you went inside, it's actually much bigger inside. And so ways of us doing that are around looking at different ways that we could look at the budgeting of services, so that we actually look at a thing like the Kent pound and bring in people who historically are kept at the outside. So that's some of our voluntary sector. We know there are new ways of building community capacity. We know that there are people providing care out there that are called care homes, but we don't engage with them enough to know what would be the right sort of environment that people could actually continue to have active, healthy aging as they go forward over the next 5 or 10 years. And how do we therefore start to move and have a different relationship with the citizens? So we move away from this medically dominated model of care towards a truly supported self-care model of care. So I'm Robert Stewart. I am a GP, but I'm also working as a clinical design director, working with KCC and the system to see how we can do some of these things differently. And I think that we should really think, considering the array of people in the marketplace out there, how we could use technology to allow the individual to be much more part of their own care, and how they could actually physically be part of their own care plan. Because it's suddenly become realistic to me that we have lots of things called multidisciplinary team meetings, but unfortunately, we never include the patient as part of that multidisciplinary team. They're not there. They're not allowed to be part of what the decision-making is or to understand what the issues are. There are places where that isn't the case, but in the main, that isn't the way that the NHS, and I'm not so sure, but the same to some degree with social care. So let's get back onto the Doctor Who bit and go on a journey. We don't know, like Doctor Who, where it's exactly going to end up, but it doesn't matter because we know that we can fundamentally change the way that this works. And so we must value our staff and build on the excellent services that they provide, but actually we need some transformation here. We need them to change the way that they work. We haven't got the money and we haven't got the resources, and it's not the right model of care for us to continue to deliver the same way we did before. So today's your chance to be part of that transformation that our citizens need. We are going to be launching a thing called the Kent Innovation Pioneer Hub later on today, and I'll talk a bit about that later. But actually it's about how do we value the richness of people to contribute towards understanding innovative changes, solutions, and getting into the barrier busting that stops us, for example, sharing information, and start to implement new ways of working both locally, nationally, and with the speakers that we've got today internationally. So that's all I want to say. So I hope we have a really good day. I'm just going to get my program. I'm going to chair the day, so I'm going to try and keep us to time. We think that we might overrun a little bit for the first part of the afternoon. But if that's the case, it's okay, because we'll catch up and we'll definitely be finishing on time.